Does anybody else have any other questions at this time? Otherwise, we'll move on to the second presenter.
Yes. Hi, Kristen. Thank
Eileen
you.
Simmons.
Yes.
Hi, Eileen.
Good afternoon,
Thank
everybody.
you for sharing.
Yes. Can you hear me? Make sure.
Yep.
Okay, perfect. Thank you all. I think I've met some of you through past few years of your national conferences. So this is going to be a lessons learned from the manufacturing supply chain side. And I'm with our 3M, I'm with 3M's personal safety division. I'm a business development manager focused within the preparedness space. And been in this role for about 14, 15 years with 3M. So I've lived through a few surges and X factors. And I can tell you this one has been nothing matched to where we were in our previous X factors. Next slide, please. So I've tried to keep this as short as possible for the 5 minutes to respect time. So as what Jeffrey just mentioned, in January 2020, 3M was seeing what was going on globally. Since we are in many different countries, we were communicating and seeing what was happening in Asia. And at that time, our leadership, or global leadership, decided to start respirator production, just ramping up production around the world. And we had equipment from H1N1 that was, sort of mothballed, so to speak. So we started to ramp that product up because it does take a good 3 months to get things through supply chain. We were following and reviewing all the national public PPE guidelines that were coming through. And our tech services really do a great job on offering clear information on product use and limitations. So there was a lot of information coming down from CDC, FDA, and NIOSH around the deconning of N95s, which was never seen before, cleaning and disinfecting the PPE. And that was for many different uses under disposable and reusable respirators. And when we say reusable respirators, we saw a huge interest in the elastomeric half face piece respirators that can be donned and doffed each day and cleaned and reused. And then, of course, on the PAPRs, a tremendous amount of increase on the need for the PAPRs and sharing those units in between ships. So we focused a lot around that information very early on. And when we look at maybe some repeatable lessons learned, and again, we're looking at it from the manufacturer side, not from the the hospital side itself. So ours may be a little different, but we had hoped that we could lend some expertise or information that we're going through as lessons learned. So we have found, and when we communicated with, and this is just globally and around the world, that healthcare facilities that had robust pre-existing respiratory protection programs really had a better, were a little better prepared for COVID, since their employees were already in a program before the pandemic, versus those who may have needed to implement one very quickly or enhance it during the pandemic. So we really go back to the joint respiratory protection, the hospital joint respiratory protection program toolkit, as a really great resource, because there was a lot of confusion about the differences between surgical masks and N95s and all of that information being thrown at a number of people. And we found that there's really great information in that to refer to. And then the second was trying to conserve PPE early on in the outbreak. And it was, the consumption of the N95s obviously really was the pain point, because there wasn't enough in the supply chain, and or as you can well imagine, within 10 days to 2 weeks, everything that was on distributor shelves were completely gone. So getting the CDC strategies on conserving PPE early on is a really good best practice. And then lastly, as I can't imagine what you all must have been through when you were trying to sort out all the offers that were coming across your procurement and supply chains desks on offers of N95s or KN95s. So we just, always try to talk about that. PPE may look simple to manufacture, but N95s do take a lot of technology. There's a lot of design information and things that go into the manufacturing those products to help filter out hazards. And of course, that could be a whole topic that our technical services folks would probably love to have with people, from the industrial hygiene side and understanding what goes into the filtration. And then how to translate some of these lessons learned to other types of facilities. And I'm going to go back to the respiratory protection program. It's probably the best way to translate that across many different facilities who are now implementing respirators in use for their daily routines, because we know from what we're hearing, there are other areas outside of hospital, especially in your long-term care, that are really struggling here, and to expand their respiratory protection programs. So, that alone in itself, having that toolkit and knowing that that's a great resource, or even coming to 3M and learning about the tools and resources that we have that may be able to help those who are now challenged or building out a respiratory protection program. So I don't know how I am on time.
Oh, my timer just went off.
Oh,
So
perfect.
you guys,
Great.
you guys are doing great. Thank you so much for sharing.
You're
And
welcome.
the Hospital Respiratory Protection Program Toolkit, I'm gonna search for that and put that in the chat box, a link to
That
that in the
link,
chat box so that people can
if
have
you hover your cursor over that, it's linked. It will take you
I
right
don't
to the
think
CDC website.
I don't think that the people in the program have access to hover. It's like
Yeah, but you'll
not a
find it.
functional slide.
Yeah, you'll
Okay.
be able to launch it from there, and it will take you right to the.
Oh yeah. Okay.
Yep,
I see what you're
perfect.
saying.
Sure.
All right. We'll take care of that. And thank you. Does anybody have any questions?
I saw maybe Keith raised his hand.
Oh, when you ramped up respiratory production or respirator production, what impact did that have on other products? In other words, what had to be ramped down in order to ramp up respirator production, and were there domino effects into that? That is a very business continuity question.
It's a great question, because we're learning more and more about that, because a number of things have happened. We did a PAPR expansion program. We actually turned off lines that were specialty respirators because of other segments within the market space. So if you think of construction and welding and all of that, we turned down the specialty lines and expanded the standard N95s, like the cup shape N95s, and then the ones that everybody wants, or the surgical N95s. So we would have more input there. So that is hurting. And the other thing is, we did pivot. We don't like saying an industrial N95, but our standard N95s that went into other industrial markets are now being sent to healthcare. So that was a pain point and a lesson learned. And then same thing on our PAPR line. We did expand on more PAPRs that are into healthcare, and we turned other lines over to expand that. So that's how we were able to address the surge on the demand. But definitely you do need to turn things down, which, as you know, it's harder to turn things down sometimes to ramp up.
So I can tell that the PPE topic is a hot one. We have some more questions for you.
Sure.
So given this experience, what can be translated for schools and childcare given the risks in those settings? So I'm wondering if that's.
We are hearing from FEMA on that. We are talking to them on a daily basis, because we are hearing the requests coming through state government. And right now, the guidance that we're hearing is face coverings. not respirators for schools. And that's what we're being told. Not to say that that wouldn't change and that there aren't counties and or states who are trying to procure N95s for schools, but currently right now, that's the messaging we're hearing as we, ask FEMA on if respirators are going to be provided for schools, and they said they're being provided face coverings right now. So,
Okay.
yep.
Thank you. And next question. Laboratory does not fit test, at least in a BLS2. Is there anything available for them?
So when they say they don't fit test, do you mean that they're not wearing tight-fitting respirators, or I didn't?
Karen, do you want to explain?
Yeah, I was just saying it's supposed to be BSL2, it's typing too fast, but most laboratories have dropped fit testing, and that became a real problem, and it's expensive. They couldn't find fit testing. So just wondered if there's something available now in the market that is more usable, inexpensive for laboratories to use. Just curious.
Yeah, that's a tough one, because if their employees are in a respirator program, I don't know what kind of wiggle room they're going to have, in OSHA's eyes, to say, I can't fit test. Is it because the availability of the fit test kits, or just that they don't have that expandability to bring more people into the respirator program?
No, just they can't fit test. They just don't have the capability to, or it's expensive.
Right.
I think it's very problematic in the laboratory.
Yeah, and so the laboratory, when you're saying at the public health side, or even within hospitals, you're seeing that as well?
Yes, everywhere. I think
everywhere. Yeah.
Public health tends to have the capability, because they have to work in a BSL-3 setting. So it's your regular clinical laboratories that only BSL-2 that have the problem. So that's not to take up a whole lot of.
It's a great question, though.
Yeah.
Yeah, and it just that goes back to my expanded areas of lessons learned, of areas that who are now challenged to have to wear respirators that never wore them before. That's more of a robust respiratory protection program. So, but yeah, I don't know if there's an answer for that one for them.
Yeah. I'm going to take one more question, and it does sound like Pat Frost mentioned that she thinks that there's an option to do self-fit testing. So just put that in the back of your mind with that conversation that was just had.
Yeah, Kristen, this is Pat. I thought there had been some resources pushed out around some sort of guidance, and I don't know if it was through NETEC or through the California Department of Public Health, but fit testing was such a problem. There was some flexibility in terms of some sort of instruction or substitution or flexibility for fit testing in a self model. And I think there's some sort of YouTube or something like that.
Okay, good to know. We'll look for that as well. Okay, so boy, you are popular. So will there be a higher production of the 1860, 1860S and 95s going into the fall? Was your next question. And then this is another one that I think is kind of related. So you can answer both of these questions. The other one is, has 3M considered a redesign of the seal area of the N95 to help reduce the amount of skin breakdown to providers that need to wear the equipment for 10 to 12 hour shifts?
Yeah, that was definitely an area we worked a lot on with our colleagues over in our Medical Solutions division on the skincare, and they've got two products that address that for the breakdown. And I don't know how to answer that one, but on the 1860 capacity question, right now we are doing expansions in production through the DPA, through the government, through DoD. They had some proposals out, and 5 manufacturers were awarded money to build expansion, and they were not on the cup style, the 1860. They were on the 1870 plus. And that's to address, the increase of need of respirators. But the 1860, currently today, we don't have much of expansion capability on that line. So the experience of the back orders or being able to address higher burn rates right now in the 1860 is a hard is a hard point for us right now, because we're so upside down on how many orders are in for that. And my medical solutions division colleagues are managing that through our MedSurg channel. And so, if you want to talk more offline on that, I can certainly engage that through a key account person. But on the skin breakdown, we do have some solutions on that as well. So we can offer, I can get that information over, and you can post that, about the skin breakdown. We do have some wound care products that or we're finding some very good positive feedback on that. Because of the fact of you wearing respirators for so long, you do need to have a tight fit. That's all about giving you the filtration, or meeting the standards of what we need to filter out, and wearing them for as long as you are is definitely going to give you some skin breakdown on the the bridge of your nose, top of your chin area. So we do have some solutions around that from our wound care group.
Excellent. We would love to get that information from you, and we will definitely post that and